Hello! Sleep disorders affect an estimated 50 to 70 million Americans and are linked to cardiovascular disease, cognitive impairment, metabolic dysfunction, and an increased risk of accidents. Despite having established therapies for conditions such as insomnia, obstructive sleep apnea, restless leg syndrome, and narcolepsy, the available treatments often have significant limitations. However, sleep experts say the therapeutic landscape is changing. As Dr. Charlene Gamaldo from Johns Hopkins Medicine points out, we are entering the golden age of sleep in terms of treatment options. In just the last 5 to 7 years, a growing wave of next-generation treatments, ranging from orexin-targeting drugs to oral agents and wearable neuromodulation devices, has begun to reshape how physicians approach these conditions. Where do current therapies fall short? Although evidence-based treatments exist, challenges with access, tolerability, adherence, and incomplete symptom control often hinder their efficacy. The first step toward better treatment is an accurate diagnosis. Dr. Michael Perlis advocates for tools like the Sleep Health Screener, which encourages structured patient self-assessment, rather than relying solely on clinicians to initiate evaluation. Let's look at insomnia, the most common sleep disorder. It affects an estimated 10% of adults in the U.S. in its chronic form, with an additional 20% reporting intermittent symptoms. Cognitive behavioral therapy for insomnia, or CBT-i, remains the gold standard with a response rate of about 70%. But there is a major challenge: the limited availability of trained CBT-i providers. For those who cannot find a therapist, the FDA-cleared digital therapeutic app SleepioRx offers an accessible, evidence-based CBT-i option. Traditionally, many patients have relied on Z-drugs, such as zolpidem and ezapiclone, which carry risks for dependence, falls, and potential cognitive effects, particularly in older adults. A major recent development in treatment is the rise of Dual Orexin Receptor Antagonists, or DORAs, starting with the approval of suvorexant in 2014, followed by lemborexant and daridorexant. These medications work by blocking orexin, the neurotransmitter that coordinates all the other wake transmitters. Unlike Z-drugs, DORAs are not habit-forming and do not cause rebound insomnia. They have been evaluated specifically for safety in older adults and have demonstrated favorable tolerability. Furthermore, new, shorter-acting options like vornorexant, designed to reduce next-day grogginess, are currently in development. Now, let's turn to restless leg syndrome, or RLS, which affects an estimated 8% of U.S. adults. For a long time, dopamine agonists have been used, but they are associated with augmentation, a medication-induced worsening characterized by earlier symptom onset or increased severity over time. Concerns about long-term tolerability have driven the evolution of new treatments. One highly innovative option for moderate to severe, medication-refractory RLS is the NTX-100 tonic motor activation, or TOMAC system. This FDA-cleared, wearable peroneal nerve stimulation device is designed to reduce symptoms and improve sleep quality. It provides a non-pharmacologic alternative without medication-related side effects, offering promise even for patients who do not respond to standard treatments. Next is obstructive sleep apnea, or OSA, affecting roughly 1 in 3 adults in the U.S. Continuous positive airway pressure, or CPAP, remains the first-line treatment and is highly effective when used consistently. However, for those who cannot adhere to CPAP, newer options are emerging. One alternative is hypoglossal nerve stimulation, an implanted device that uses electrical stimulation to push the tongue forward during sleep. Recent trials, like the Osprey trial, investigated a device using proximal hypoglossal nerve stimulation, showing a 65% response rate after 1 year of treatment. Furthermore, in 2024, the FDA approved tirzepatide for adults with obesity and OSA. While weight loss plays a major role, researchers suspect this drug also improves OSA through other factors not yet fully understood. We are also seeing the development of investigational oral medications. IHL-42X, a combination of acetazolamide and dronabinol, has entered Phase 3 trials and is associated with reductions of up to 83% in the apnea-hypopnea index. Another oral drug, AD-109, showed positive results in phase 3 trials, offering real hope for a simple, oral pill solution for sleep apnea. Finally, let's discuss narcolepsy, a disorder affecting an estimated 30 to 80 per 100,000 people in the U.S. Unlike insomnia, which involves hyperarousal, narcolepsy is associated with a deficiency of orexin, the neuropeptide that stabilizes wakefulness. Current therapies largely address downstream symptoms rather than this underlying deficiency. Now, however, orexin 2 receptor agonists are being developed to restore wake-promoting signaling. While none are currently approved in the U.S., the FDA recently accepted a new drug application for one such agent from Takeda on February 10th. Another drug, alixorexton, has shown promising results and is advancing to phase 3 trials for narcolepsy type 2. According to Dr. Atul Malhotra, the improvements in sleepiness seen with these new orexin agonists are jaw-dropping. In fact, experts note that orexin agonists, like oveporexton, are the closest we've come to a functional treatment for narcolepsy. As research progresses, targeting the orexin system might even extend to treating circadian rhythm conditions. From targeted pharmaceuticals to advanced wearables, we are truly at the dawn of a new era in sleep medicine. Follow HealthTalk.org for trustable scientific data. Stay healthy, stay informed, and I'll see you in the next video.